Kathleen Ryan is the Executive Director of Clinical Governance and Information Services at Mid North Coast Local Health District, New South Wales Health Service.
Just wanted to walk through where we from Mid North Coast have been and where we hope to go with I guess, our journey around developing that culture of continuous improvement and innovation. We have 7 hospitals and 9 community health centres. The other thing is that we've got some really great hospitals, and there's been an improvement in that recently. We've redeveloped Port Macquarie Base Hospital, $110 million redevelopment. Kempsey District Hospital, $87 million redevelopment. The Minister's been very busy opening hospitals in the Mid-North Coast, or the revamped hospitals. And there's further plans for Maxwell and Coffs Harbour as well. I think our facilities and our services are actually now world-class and quite state-of-the-art. We have the opportunity next year, we actually go to full medical training, so the New South Wales Uni Rural Medical School will actually be 1 to 6 years training on Mid-North Coast. So that's probably the first in a regional area. We also link with a number of other universities for clinical placement for nursing, allied health, as in physio, speech pathology, etc. So I think, again, quite innovative. E-health is another big area that we're really pushing forward on, also quite advanced for a regional area. So in addition to some of our electronic medical records, which we're not quite there yet, if people come into hospital and we're still very paper-based and they go, well, I go to the bank and it's all electronic, so why not in hospital? But anyways, we are getting there eventually. But I think what we have done is really use some of the smarts around the technology with our models of care. So connecting clinicians in Dorrigo, which is up on the Dorrigo Mountain, to clinicians in Coffs Harbour. So that specialist service that you might need, you can digitally transmit the X-ray from Dorrigo to Coffs, and they can have a conversation with the doctor from one spot to the other instantaneously. Looking at residential aged care facilities, how can we support the nurse and the patient in the residential aged care facility who may need specialist interaction without having to bring them to hospital. So we're using a lot of technology to really think about how can we deliver our care better out into the community. So that's something that we're actually doing right now, and I think we're well advanced in that area. I think interestingly, the conversations today have been a lot about expanding your customer base and looking at new markets, things of that nature. We don't want more customers, we want less customers. So our innovation has a different focus. It's actually providing the healthcare that's necessary for our community and keeping our community healthy and out of hospital. So we have perhaps a reverse incentive for our innovation. We have 2 sim labs. We have one in Coffs Harbour and one in Port Macquarie. Again, just a very innovative way to actually provide education to our current staff and also to our students who are on clinical placement. I think we've got good foundation blocks there from the services that we provide. Probably our challenge is really then, how do you actually embed that culture of continuous improvement so we do meet the healthcare needs of our community? So a part of that is thinking about the leadership, really that improvement capability. But often the capability around change and improvement is not part of how they're thinking or their skill set. So people come after 6 years at medical school and 4 years of nursing, and they've got all the smarts around the science of health. But really coming into an organisation then where part of the role is really to continuously improve, is just not part of their thinking or their knowledge. So there has been quite a push to really develop that capability in our organisation. And of course the culture of innovation. There's been a number of programs, and I thought I'd just touch base on all of those, because then you might just sort of get I had the feeling that we were sort of almost like trying this and then trying that and then trying something else to really get to that situation where we had that leadership across the organisation, we had the capability for improvement. One of the programs was the Clinician and Executive Team Leadership Program. So that was a new program that came out of an organisation called Health Education Training Institute, which is a New South Wales-based organisation. And this was quite different because we actually had managers and executive and clinical staff coming together to learn. And we had teams, we had 75 people across the organisation who looked at 6 different initiatives. And it was very much focused on adaptive leadership. And I think that was also quite challenging for some people to think about that, because in health we know we're a complex adaptive organisation. So really looking at adaptive leadership was really important, and some of that concept of understanding the other person's frame of reference and all those sorts of things was quite new to some people. And we had surgeons and anaesthetists and nurses and physios, etc. So that was quite a good outcome from that. And I think part of going through that, people actually went through workshops, looked at working in teams, and actually looked at leadership triangles. So that was quite challenging for some people. They actually had to sit down with 2 other people, so triangles, 3 people, and actually talking about their leadership challenges. Quite a different approach, and really created that opportunity for people to think about what are my leadership skills and what are my current challenges and how can other people help me. That was a program that went over about 9 months. And I think probably for me, the challenges is always the sustainability afterwards. So how do you actually continue that learning? Just another example of another program which we do present locally is the Clinical Excellence Commission. Again, another statewide organisation, is also about leadership. And the fundamentals of this program is about learning about continuous quality improvement. So again, it's participation through workshops and mid-year reviews, etc., and then celebrating the graduation. So again, we have had some great projects going through this. We see local improvements, and we had 12, then 16, and this year 23 people participating in that. So we can see that people value it because there's more and more people signing up to it. And we have great projects coming out of it. But it's that sustainability. How do those people actually reapply those skills that they learn within those programs and stay connected, reusing that skill set to actually continuously improve and to think about innovation. The sustainability for me is still something that was missing. A third program, also a state-run, is called Centre for Healthcare Redesign. So the slightly different focus in this one was really bringing in process re-engineering, lean methodology. So it was a similar sort of thing. It was about how do you actually drive change and improvement in the organisation. And again, we had a number of people going to this annually. So this is a state-run program, so we only have 2 or 3 or perhaps 4 people from our organisation going each year. So again, it was sort of individuals going off, doing this program, doing great projects while they're doing that, and again coming back into the organisation and sometimes being a little bit lost, I think, a bit lost to how would that actually reapply those skills. So as I said, some great outcomes, and this was one particular one where they introduced the Patient Safety Board, which really brought the whole clinical team on board, people taking their own local data and putting it up on the wall, and the whole team going, okay, we understand what we need to do, why we need to make that improvement. The concept of those patient safety boards have actually taken organisational wide now. What I've found that people in the organisation often got a bit confused. So is this clinical practice improvements, or is this redesign, or is this something I need to do through what we call settle, and where does the X team fit in, etc. So I was quite keen to think about, well, it actually all fits here together. They're all methods of improvement. So put this together in, well, here's a whole organisational wide approach to, you have some big programs of work, you've got your strategic plans, etc. And really that these improvement methodologies and the programs are something to actually help us as a whole organisation drive forward our strategic direction. So when I actually put this together and explain that to people, it was aha! So I can see how this is actually critical to us as an organisation for us to actually achieve our strategic intent. So it was trying to demystify, I suppose, and trying to explain to staff and managers and executive, how it does all fit together. And if there is a problem, a challenge is identified, there is a way to actually deal with it, and there's a number of methodologies and a number of people in the organisation to help. So that started to help distill, I think, and perhaps actually put it all together. So it is a coherent group of programs. The thing that I stumbled across, catalyst approach. In looking at that, to me it was the thing that would bring it all together. For me, the catalyst approach was about connecting people with people, which is what we were trying to do. So there's lots of people in the organisation that have had some sort of training in improvement methodology. So they're obviously motivated. They're often self-selecting to go and do those programs. And also then connected the programs with the programs. So all those different programs I was talking about, rather than them feeling as though they're isolated programs and they're not, coherent across the organisation. The catalyst was something that I saw that would bring that together. So catalyst being that there's a number of people that we trained up in the organisation. We've got 120 now. I think we've got 30 lead catalysts, so they actually took the lead on how we would actually develop the program for us, for our organisation. So the concept was that there'd be people across the whole of Mid-North Coast who were the go-to people. So then it was advertised and communicated out who were the catalysts within my area. So it's just having that good idea. So, I've seen something that I know we can improve. I've got a bit of a good idea. But where does that go to? So I know, previously, people would have the good idea and then immediately forget about it because they didn't quite know what to do with it or where to take it or how it would actually be implemented. So to me, that actually exactly what the catalyst was, connecting the people with the people, going to someone who could just help them either navigate through some of the programs of work that I spoke about earlier, or just connect them with with someone else in the organisation who can get the job done. So we looked at some of the internal supports around that, and we certainly had training and development, some sessions with the executive team. So I was actually presented to the executive, and the executive obviously bought into that and agreed that we should actually implement the catalyst. And I think the other thing is that we kept emphasising that we weren't talking about a program. So we kept talking about it as the catalyst approach. It's actually a framework that actually brings it all together. So we were trying to create just a space where people could go and flow chart or process map or do whatever they want to do with their ideas. So we are starting to create them around the organisation. So it's not just one place. And each of the hospitals across the district are thinking about, well, how's it going to work for me? I think just recently, I know Tess was up and did the rounds of the district and hearing from people that, oh no, we haven't really done very much at all. But then the conversations would happen and what they had done would come out. Oh yeah, we actually just had this simple idea about fixing X, Y and Z and we just did it. So to me, some of it is actually just almost given permission to have the good idea, to have the conversation, and quite spontaneously, people are just making small changes, small improvements in their own area. So it doesn't have to be huge, big projects that needs lots of money and lots of resources to actually get done. So it's often quite small. And I think on reflecting on what some of the people were feeding back, is it's just created a different conversation of almost like that can-do attitude. To me, it has been a journey. I've been involved in all those programs previously. As I said, there was I think the intention was always right to develop the capability for improvement and innovation within our organisation, but it did feel a little bit like isolated programs. So I think underlaying that or overlaying it, I'm not sure which way it goes, with the catalyst has really helped bring people together. And as I said, connecting people with people and programs with programs is really how we see that will drive innovation for us anyway in Mid-North Coast. So thank you.